Hello everyone, I am Dr. Tejinder Singh. I am a senior medical oncologist practicing in Apollo Hospital, Navi Mumbai. Today I am going to discuss about type of cancer known as sarcoma, also known as soft tissue sarcomas or bone sarcomas. July is the month which is known as a sarcoma awareness month. That's the reason why we are discussing about this particular disease. Sarcoma is a very rare disease. They constitute less than 1% of all the cancers, and it can happen in pediatric population and also in adult population. Normally, we divide them into a bone sarcomas and something known as soft tissue sarcomas. They originate from the tissues which are beneath the skin. It could be from the muscles, it could be from the tendons, fatty areas, bones, blood vessels, or the nerves. So they are now been totally clubbed as sarcomas, but like I said, mostly we call it a bone sarcoma or soft tissue sarcoma. There are many different types of sarcomas which are known. So these sarcomas happen because of some reasons, and some of the known reason is a patient who has got radiation previously, some kind of chemical, especially there is something known as polyvinyl chloride, which can lead to bladder sarcomas. Genetic abnormalities. There are certain genetic abnormalities like patients who are having multiple neurofibromatosis, and also related to certain diseases like condition where your immunity becomes low. So we call it autoimmune diseases, or in patients who are having immunocompromised state like HIV. So these are the some common causes for sarcoma, but it can happen to anyone because large bulk of patients they will not have these kind of abnormality. Now talking about the prevention is something like anyone who is having multiple small lumps anywhere in the body should ideally get investigated. But there is nothing called any kind of particular investigation which will be able to help you with preventing the sarcomas. How do we diagnose? We diagnose it by doing a scanning to see the extent of the lesion, whether how extensive they are. Because since it happens mostly in the arms, legs, chest, like the head and neck area, it is easy to be seen. So we do the scanning to see the stage, and also we do a biopsy. There are two different types of biopsy. We call one is called two-cut biopsy, another is called excision biopsy, which is removal of the full lump. And these two biopsies will give an idea what kind of stage a person is there and what kind of grade the tumor is there. Based on that, we decide on the treatment. Treatment basically constitutes three important parts. One is the surgery, another is the radiation, another is called chemotherapy. Surgery is a modality which is most commonly used because this is used in a curative setting. And the type of surgery they do is they remove the tumor along with a good margin. And in patients who are having bone sarcomas, which is known to happen in the teenage population and also in that little bit later on age group, they require a removal of a particular part of the bone after getting chemotherapy. Radiation nowadays is part and parcel for most of the sarcomas, and those patients where the disease is little bit on the high risk and where the disease is metastatic, we normally go for chemotherapy. A lot of new advancement have come now. Our surgeries have become less invasive. Chemotherapy now we are doing a lot of testing called next generation sequencing. So we are able to find which patient should require what drug. And immunotherapy, targeted therapies are going to be the future. But remember one thing: sarcomas are some disease which are easily visible, can be brought to notice very early. If the disease is diagnosed early, the probability of getting cure is very high. So we should all be knowing what is sarcoma and how to get the treatment, and which is easy to, like I said, easy to pick up very fast. Thank you.